Good day to everyone. Today we are going to see about dermal fillers. I am Dr. Mohanapriya, voice behind dental shots. Dermal fillers are the most common facial aesthetic treatment and it is a non-surgical regenerative procedure. Dermal fillers are used to treat moderate to severe wrinkles and folds, acne scarring, folds and depression, to restore the age-related facial soft tissue loss and also to augment the facial structures to improve the nasal function. Over 150 injectable dermal fillers are available in the global market. The dermal fillers can either be a permanent one or a temporary. Dermal fillers are broadly classified into a collagen, hyaluronic acid and biosynthetic polymers. According to the American Society of Aesthetic Plastic Surgeon, the statistics in 2008 says that hyaluronic acid-based fillers are the most commonly used, followed by the calcium hydroxylapatite, collagen, and lastly the poly-L-lactic acid. So where are these dermal fillers injected? The depth of the injection is dependent on the depth of the furrow or the defect. So if it is a fine wrinkle, then we can deposit the filler in the superficial dermis. If it is a moderate wrinkle or a fold, then we can deposit the dermal fillers in the mid to deep dermis. If it is a very deep fold, then we can deposit the dermal filler in the subdermis or hypodermis. The dermal fillers are available in the disposable plastic syringe. The gauge of the needle used in the dermal filler is determined by the viscosity of the filler. As well as if we are going to treat a deeper defect, we have to choose a more viscous filler. The depth of the injection is directly proportional to the depth of the defect. There are 4 techniques of injecting a dermal filler. First is the serial puncture. Second, linear threading. Third, fanning. Fourth, cross-hatching. This is the pictorial representation of areas treated with dermal fillers. Starting with an alphabetical representation in this picture: A. Nasolabial fold, B. Marionette lines, C. Vertical lip lines, D. Chin wrinkles, E. Lip augmentation, F. Deep glabella lines, G. Temporal hollows, H. Cheek augmentation, I. Orbital rim, J. Nose augmentation. Kindly pause this picture and see. This picture says you which dermal filler can be used in which region of the face. For example, in the mid face, certain dermal fillers are recommended. For the nose and chin region, certain dermal fillers are recommended. Kindly pause and see the trade names which is being given here, which dermal filler is appropriate for which area. As in every treatment, the complication is also occurring in dermal fillers. It can be broadly classified into an immediate complication like pain, hypersensitivity and anaphylaxis, early complication like swelling, erythema, infection, overcorrection and necrosis, and the late complication like activation of herpes simplex virus, nodules, granuloma formation, and permanent complications such as scarring. So this tabular column gives you an idea which filler gives what type of early technical complication and what are the possible late adverse effects based on their trade names. Most of the adverse events are responding to the medication such as topical steroid cream to systemic steroids, antibiotics, anti-inflammatories and antihistamines. If it is not subsiding with the medication, then we can require a surgical intervention such as abscess drainage and nodule excision. Rarely, an emergency admission can be needed for hypersensitivity reaction in dermal fillers. I hope you like this video of a simple outline about the dermal fillers. If you like it, like, share and comment and subscribe to Dental Shots. Have a great day. God bless you all.